Ashley, owner of Amare Healing Arts. This is Dani. Dani, what do you do? Everything. Dani does everything. Dani is our office manager, assistant. She handles client relations, all the back-end magic that happens here. I am a manual lymphatic drainage therapist certified in plastic surgery recovery, autoimmune, and cancer. We are a plastic surgery recovery center specializing in manual lymph drainage to get rid of swelling. We also do a lot of post-op care, so things regarding garments, things regarding foams, scar, fibrosis, all the ugly stuff, the ugly side of plastic surgery that nobody talks about. That's what we're here to do. So today we're going to talk about exactly what it is that we do. So as a center, we specialize in manual lymph drainage. And we're going to talk about what that actually is. So, Dani has a couple questions that normal people would ask when you call or when you're Googling, or we have a bunch of blogs that talk about it, but we're starting a YouTube, so we're doing the videos on them. So, what are your questions?
All right. I think they're pretty straightforward for anybody who would come into this. So, when I first started, I was like, manual lymphatic drainage. Immediately I thought of some sort of surgical procedure involving needles, devices. Right. It was very scary. So yes. I think that would be your first, my first question initially is what the heck is manual lymphatic drainage? What is it used?
That is a great question. What the heck is it? So there's a lot of misconceptions about this. Traditional manual lymph drainage is done with the hands only. It is a massage technique that originated in Europe. It is meant to move your lymph system. So what is your lymph system? You have blood, you have tissue, you have bones, but then you have lymph. Lymph is the thing that's that white clear fluid when you get a cut or a scrape that's not blood. That is your lymph. That is responsible for healing any of the scrapes, cuts in your body. It's kind of like your body's way of spackling things. It carries nutrients, but it also is your body's waste system, your lymphatic system. It gets rid of waste. So all that cellular debris from the broken cut. So it starts with, you get a cut, you get that fluid that comes out. That fluid is lymph fluid. It's full of white blood cells, proteins, fats, water, and it's meant to kind of make the area sealed up with the blood so that all the nutrients start rebuilding in there and build tissue. It also flows away from that area and takes away any of the dead, broken cells and broken tissue from that cut. So that's what the lymph is in the lymph system. What lymphatic drainage is, your body pumping out the fluid. So that actually happens on a regular basis, day to day, every day, all day. So any pumping movement that you make, any musculoskeletal movement. So what does that mean? When your skeleton is moving and when your muscles are moving. So your lymphatic system doesn't have a pump. It's not like your heart where it's just always regularly pumping, or your lungs where they're constantly just breathing. Your lymphatic system moves by your body's musculoskeletal movement. So you physically have to move for that fluid to pump, and it pumps very slow all day. So when you are sick, when you had surgery, certain autoimmune, certain medications cause you to swell up more. And if you're not moving regularly, like if you had surgery, you're kind of sitting a lot and that fluid is just getting stagnant and building and becoming a problem. So lymphatic drainage, again, what is it? It's us, therapists, physically moving your lymph system by a pumping motion done on the skin. So Dani, let me have your hand. Let's put this up here. It is extremely, extremely gentle. So it's a very, very gentle pumping motion done to the body, just like that. Super, super, super gentle. Is that gentle enough?
It's pretty gentle.
It's pretty gentle. So it's meant to be done on cancer patients, people fresh out of post-op, 48 hours, sometimes even 24 hours, to get all that stuff moving and up and out of there. It's cleaning the body out of all that debris so that it's not sitting there, so you have room to heal. So hands-on manual lymph drainage is done that way. There are a lot of people that do lymphatic massage, lymphatic drainage, and they will push and they will scrape and they will rub and they'll use machines and all kinds of crazy stuff that does not affect the lymph system at all. The lymph system is a hair deep, millimeter deep, just beneath your skin. It's very, very subtle. It runs through your tissue, your muscles, your bones, your organs, your mucosal lining, anywhere you have fluid. It's also spinal fluid. It's also in your brain. So it's a very subtle thing. Any lymph drainage that is done with pressure or a serious pushing or digging is not real true lymph drainage, and it's not really affecting your lymph system. And a lot of times that can actually cause problems. So true manual lymph drainage, the long answer, because that's what we're here for, right? The long answer, true manual lymph drainage is a gentle pumping motion done on the skin very lightly to stimulate and dilate the lymph vessels. And what that does is get your body to reabsorb that fluid, to suck it back in. So as Dani was saying, a lot of people think lymph drainage is like, I'm going to take a needle and stick it in you and suck out your fluid or cut you open and drain you, which is very popular in Miami, very popular in Colombia. Not what we do, not true manual lymph drainage. That often tends to lead to fibrosis. It tends to lead to scarring, tissue damage, all kinds of craziness that we're not going to get into in this video. There will be another one coming on that later. I can talk for hours about it, but that is not what we do. The lymph fluid is meant and designed to be reabsorbed into your body so that it goes through all the body systems and comes out through your urine, and that's how fluid comes out of you. So that's where it all ends up, and that's what lymph drainage is. It's getting your body to reabsorb that fluid to get it out of you and cleanse you and full body detox. Is that answering your question?
Oh, whoa, yeah. Okay. So you mentioned surgery. So what does this mean for me? Like, in all reality, am I only going to be interested in this if I'm having a surgery or maybe having problems with, like, you mentioned immune system? Is this something that, like, every day you know, like somebody like me who maybe doesn't have any major issues needs to think about, like, you know, how do I say this? Like,
what do you do?
Yeah, do I need to worry about this?
Yes. So it's not really something to worry about. So there are a lot of conditions that will come up. So anything that really presents swelling in the body, seasonal allergies, all the face clogging of stuff. We have a specific protocol just for the head, neck, and face to drain all of that stuff out. That is fluid. It drains into your lymph nodes in your neck. 3 major areas of lymph nodes: neck, armpits, and hips. So when things are going wrong, those areas get achy and swollen. Other areas that tend to get achy and swollen are right by the ribs, right underneath, the legs, like right across the back by the kidneys. A lot of those areas that are kind of full of the clusters of lymph nodes. So for a normal person, seasonal allergies. After a cold, we don't suggest it during a cold. Your body's fighting off enough. We need it to rest. Because this is a full body detox, it can be very exhausting. You do need a lot of water. We're getting your body to dump the water that's in it. So we need to replenish that with fresh, healthy water so we can clean out that lymph system. For healthy people, athletes, super healthy people, power lifters, things like that. We have a lot of body breakdown when we're working out. You know, they talk about antioxidants, they talk about proteins, they talk about all the good healthy things that you can do. Detoxing and cleansing is one of them. So it's suggested that once a month, like that would be, you know, once a week would be like super optimal. But once a month for general health, you know, lymph drainage, because it cleans out the body's immune system. That's exactly what it is. Your lymph system is your body's immune system. You'll find that all over the internet. So we want to make sure that, yes, that's staying healthy, but there are tons of things that normal people have that we don't realize, like, oh, lymph drainage can help this. Like, oh, I busted my lip. Okay, instead of suffering with it for like 3 weeks, get lymph drainage, 2 or 3 sessions in the face. It takes that swelling down immediately and clears out all that stuff. And it helps with a lot of scar healing. People with issues, fibromyalgia, MS, autoimmune, COVID recovery, because that is a big hit to your system. Anything that really hits your lymph system where it's kind of like an unknown, I went to the doctor, they said I don't have any problems, I'm supposed to be fine type of situation, you might want to try lymph drainage. That might be something that'll kind of clear it out, because a lot of those unknown, unseen things are bugs hiding in your immune system that's kind of making you tank. Adrenal fatigue is a huge one that normal people have. Sitting at a desk all day, drinking coffee. People that are immobile, their system gets super sluggish. So that is one of the number one things that we see in here is the adrenal fatigue, the brain fog. Nurses tend to get really swollen ankles. They're on their feet all day. Doctors tend to get very swollen legs, things like that. They're on their feet all day. Even if, you know, you're not a doctor or a nurse and you're on your feet all day, if your legs blow up, we can, first of all, get that down. Second of all, give you dietary changes to help boost your lymph system so that it starts pumping that fluid upwards. Because again, there is no central pump. So if your legs are not pumping and there's no compression in your legs during the day while all that fluid is pooling down there, you're going to get what they call cankles, where your calf and your ankle kind of fuse. Pregnancy, that happens as well. So as far as normal people, there are so many things. Okay. I could list like the craziest things, but we're just going to keep it super simple. There's always something lymph drainage can help with, especially if you've had like a phantom problem for a while, then you might want to try lymph drainage, something like that.
Okay, I think that my only other question like to do with that would be cancer related, because that's the only other time I've heard of like lymph nodes or a lymph system is when you have cancer and you have to get like radiation. So how does that come into play?
So it's usually cancer recovery. So we have 2 sections to Amare. Amare is a plastic surgery recovery center and holistic clinic. The plastic surgery recovery center, plastic surgery recovery. The holistic clinic, we deal with all of that. We deal with recovery. So cancer recovery, thing of the past, which is a great thing of the past now, is lymphedema. It's becoming a lot more well known, but it's becoming also a lot more less caused unless you're born with it. So there's primary and secondary lymphedema. Primary is where you are born with it. Secondary is where it's caused. So like cancer, when they remove your lymph nodes, your body doesn't have anywhere to put that fluid, so it tends to pool and it gets that really big arm with breast cancer when they take them out. A lot of other things, throat cancer, all your lymph nodes, radiation, it fries them. And then, you know, you wind up getting all of these different problems. So anywhere that lymph nodes are removed can cause lymphedema. And a lot of times with cancer, unfortunately, we see that. Now, back in the day, they weren't aware of such things as lymphedema. Even, you know, regular surgeries where they would take things out of you, they weren't exactly cautious with the lymph nodes. So nowadays, we don't really see that as much. We see a lot of primary lymphedema where people are born without lymph nodes, or lymph vessels where it just kind of, their limb gets huge. There's an entire community on that. But cancer, it's the same thing. You get that lymphedema where your limb blows up or your area of your body blows up. We specialize in compression garments. We're certified fitters here at Amare, so we can fit you for a compression garment, talk to you about them, educate you on them, get you in one that's going to keep that fluid out of you, and kind of help with everything, as well as your regular maintained lymph drainage, and then dietary and lifestyle changes to keep that fluid out of you also. But yes, unfortunately with cancer, that does happen. And we do tend to see a lot of lymphedema in the cancer community, but thankfully it is being addressed now. It's not just kind of a phantom thing.
So is this like something you need to keep up on?
Yes.
Like, you know, do you go once and you're good for a while, or like how often would somebody have to consider making a session based on what they're dealing with?
So it depends. That's also something we would talk with them about. So if you have cancer and it is a permanent thing, it might be something where we see you once a month, once you're good with your garment, once you're good with, you know, your diet and not having salt and staying away from your trigger foods and staying away from things that are going to blow you up like the heat. And you're being a little more cautious with that. We do have athletes with lymphedema that we work with, and they wear their compression garments and, you know, they're moving, they're pumping, they're doing all the things for their body. There are certain lymph-friendly activities that kind of help move the fluid through the body naturally. But sometimes we'll get that call every once in a while like, hey, I did a bad thing, I'm blown up, can you help? So it's kind of on an as-needed basis at that point when you're living with lymphedema, or anything that causes manual lymph drainage to be needed regularly. So we try to, as much as possible, limit it as far as how many times you're coming in. But at first, to get it under control, you might want to come in a lot more frequently and get them done a lot more frequently, because your lymph system is so tiny, all that swelling is crushing it. So once we get the swelling off of your lymph vessels, it can start pumping normally and naturally again. That's why sometimes even when you do have like a certain amount of swelling in your body, it's super persistent, because as you work out, you're kind of agitating it, and then your lymph system is working so hard to pump it out, and there may be other underlying factors causing it, such as blood pressure medications, side effects from birth control. Tons of things have a side effect of edema. The word edema just means chronic swelling or excessive swelling. Sometimes it's caused by medications, like I said. Sometimes when you eat too much salt, you blow up. Some people blow up massively. Some people just kind of get a little swollen, a little puffy, like when you've had too much to drink or too much to eat with salt in it. So it can go anywhere on the extreme, but usually that's how we'll say, we'll take a look at you and be like, all right, well, this is what we can do depending on lifestyle changes that we can make.
Okay. I guess like my only other question would be, there has to be something you can do at home to like support, because I mean, obviously you're spending a lot of time taking care of your lymph system, so what could you possibly do at home to help that?
So there are a lot of things that cause stagnation of lymph anywhere. So like we said, if it's primary and it's a lifestyle thing, you're probably already taking care of it, you're probably already aware of it, because your limb is huge and you're really uncomfortable. So taking care of it at home, you're working on finding triggers. Lyme patients get lymphedema and they don't realize it because they have this chronic pain in their joints and in their body all the time. That's like a low level of inflammation everywhere. They're constantly being triggered and constantly being inflamed. So with something like that, you could have a dairy allergy, you could have a gluten allergy. There could be some food that you're eating that just your body doesn't like, that causes you to trigger that little bit of inflammation, and it just keeps piling on. So lifestyle changes, and at home, definitely, we also do life coaching, nutrition, counseling as well. So we'd be able to sit with you and talk with you and work those things out lymphedema-wise or swelling-wise, even on a normal person. But at home, there are tons of lymph-friendly activities. So Deep breathing is one of them, which is why yoga is so good for that. Anything that has full body musculoskeletal movement. So a lot of things that we do nowadays are very linear. Even like weightlifting, it's very up and down. It's not very dynamic or broad. So dancing, yoga, swimming, things that are super dynamic that get you to move your whole body in lots of rotating ways will really help with moving the lymph system.
Does heart rate or breath matter?
So heart rate, the lymph system, again, because it's not the vascular system, heart rate isn't really a good key for that, but that's a really good question. Breathing definitely does. Any full breath. So if you're breathing shallow from your chest where it's like,
yeah,
that's not really going to pump it that much. You want like full yogic breaths where we're making a movement, we're taking a full inhale, and then we're taking a full exhale. And really pumping that stomach and moving at the same time the lymph nodes in the armpits and moving at the same time the lymph nodes in the hips. So yes, deep breathing does work. But it's paired with the movement of yoga that really triggers it.
Okay.
So exercises like that, we're going to do a video on that as well, as like movements for triggering lymph. Lymph yoga is something that we teach privately, person to person, because again, everybody's different and everybody's body capabilities are also very different. So at home, there's really the lifestyle stuff that you can do. The getting up and the moving, drinking tons of water, because again, your lymph system is made of water. So you want to drink tons of water. Yes, I've heard the suggested amount is like half your body weight in water. I always say do way more than that, because if you're having coffee, it's a diuretic, you're pushing all that water out of you and dehydrating everything. If you're having salt, you're going to need more water to get that out of you. And if we had to sit and look at every single ounce of water to every single ounce of water we're losing, it would be a lot. So always more than your body weight is a good thing. Recommended is like half a gallon to a gallon. It's hot out. If it's, you're working a lot, I'm on my feet a lot, so I want to drink a lot of water, keep that lymph system hydrated and pumping and cleaning out through you. Because when your lymph system gets dehydrated, all of that stuff gets sluggish and sits. And that is one of the number one things that slow down your lymph system, is not having enough water or drinking things and eating things that deplete your body of water. So the water, the dietary things, the movement, it's really a whole lifestyle thing that gets your body moving, which is really why we don't think about it. We don't really think about, is my lymph system moving today? Like we know when we're not breathing properly, we're like, kind of out of breath.
Something's wrong.
Gosh, there's a problem. But you don't realize when there's a problem with your lymph system because it's so tiny, yet it's literally your whole body. So when we're dealing with lymphedema, lymph drainage, plastic surgery recovery, all of these things, it's kind of like you have to really know what's going on with your lifestyle and your body. It's a whole approach, which is why at Amare, we're a holistic clinic. We take a holistic approach to your healing. Same thing with your post-op recovery. It's not just, let's massage you and get you out of here. It's the foams, the garment, your diet, your medications. Some of the oxys and the Percocets cause more swelling, unfortunately, in some people. If you already have lupus, Lyme, MS, some sort of, autoimmune or high blood pressure or diabetes, something already going into surgery, your lymph system is already compromised. You're going to have a hard time getting that swelling off of you after surgery. So you may need a couple more sessions than usual. But if you sit with someone who actually, knows about the lymph system and is educated, we can kind of get you on a track and get you on a schedule that is geared towards lifestyle lymph movement, even post-op. So we kind of do it all, and we do offer virtual consults pre-op and post-op without the lymph drainage to talk about these things before you go into surgery. And that's why, because it's educating you on how to take care of your lymph system and the swelling to protect your results post-op. So we do a lot of that in the room with our clients now, but we can't always do that. So we do offer virtual consults, virtual sessions for counseling with the lymph system and post-op recovery.
Oh, that's handy with COVID and everything happening right now.
Of course, and we do it for all of like the cancer and autoimmune stuff regularly. That's a huge part of what we do, especially with COVID recovery and all of that. I've seen a lot of clients 100 days post-COVID with very, very shut down systems, and they constantly relapse and have relapse symptoms which could go away in 4 days, which we've gotten to go away in 4 days. The heaviness of the chest, the not being able to fully take a breath, your whole lymph system is sluggish. You got to drink water, you got to do all these lymph-friendly things, come in and get lymph drainage done, clean out your immune system. It just fought a really hard battle. So we want to make sure that we're cleaning it out and getting it back to where it needs to be. The rest of your body is healed. But again, you're sitting around, we're inside, we're quarantined, we're not really moving a lot, so we're not getting that stuff up and out of us. And that's kind of what we do is take a full approach to it and give you stuff to do to rehab at home.
Cool.
So any other questions?
I think that's it.
Okay.
Yeah.
So that is our little lymph video introduction. We will be doing more of these on certain topics. We will be doing more of these on, things that you guys have asked us through Instagram. Check out our Instagram, Amare Healing Arts, all one word. Check us out online, AMAREHEALINGARTS.com, and give us a call and reach out to us. Send us emails. We love hearing from you guys. Check us out. And that's it. This is Ashley. This is Dani. We are Amare Healing Arts, and have a good rest of your day. Bye, guys.